G'day guys, sorry I can't be there at the moment. I've been put on some bed rests. I've got some pretty bad throat infection, so I thought I would try and do the next best thing and deliver this over YouTube in the hope that you can do it in your own time and take the time to actually go through the information. I'm just going to start with the cause, what I would have presented in class the other day, some exam technique, and then just a conclusion. So this is the lecture that I gave at the university during the holidays. It was based around the whole premise of looking at the exam technique, how you're going to improve, those sorts of things. So we've done a lot on exam technique, looking at the types of questions, looking for the syllabus term, looking for the verb, the importance of putting content in there, and of course the analysis is the most important part. Okay, being able to show that you can take a concept and apply it rather than just rehash the concept. When it comes to the exam, both your trial and the HSC, it is going to be 3 hours worth. Okay, and it is based off of, as we've said before, 1 mark equals roughly 2 minutes. Having said that, you don't need to take 40 minutes to do the multiple choice. Okay, so you can make up some time, but you need to prep your time very carefully, and that's where doing practice papers under time constrict limits will actually help you there. Don't forget you get 5 minutes reading time in which to have a look at the questions, work out which ones you want to answer first, and then of course it's up to you how you're going to answer your paper. Some people like to start at the back, section 2, get those essays out of the way, then come forward. Others like to start with multiple choice just to ease their way in. It's entirely up to you. Just remember that you can't write during that reading time. Okay, you're not allowed to hold a pen, do anything like that. And don't forget to take in black pens, please. Okay, it's NESA's requirement that you do actually do that. All right, when you get into the paper, just reminding you of the fact that you have limited space in which to write. When a marker is actually making this paper here and their writing is worth 3 marks, okay, they expect that a student would be able to answer a band 6 response within those lines. Okay, so 1, 2, 3, 4, 5, 6, and 2 for good measure because the difference of styles of writing. Just remember anything outside these corners here will not be marked. Okay, so my advice to you is to draw a line straight down those areas there so that you don't go outside those areas. All right, and plan your response so you don't write really big at the start and then try and squeeze it all in at the bottom, that you are consistent with your writing and that it's legible and easy to read. Talking about easy to read, writing is really important, okay? Too big, too small, can't even read. The marker in the HSC is not going to take its time to actually try and work this out, all right? It doesn't mean you have to be exceptionally neat, all right? But there are things you can do. Like number 1 is not write too big, not leaving too much of a gap between words, because this person here, you could probably fit in easily another 2 to 3 sentences with the spaces that they've got. And of course, this example down the bottom is you can barely read what they're saying. Okay, so something flow to blood pressure in excess of 95%. So make sure it's legible. If you're having difficulty with that, you need to slow yourself down and maybe print out what information you're going to have a look at. Okay, so your trial and HSC exam, okay, you have predominantly core 1 is worth 30% and core 2 is worth 30%. Both of those are assessed in both multiple choice and short responses. Okay, so that will multiple choice, short responses, and then you study 2 options, sports medicine and improving performance, and those have 2 essays attached to either of those. Okay, remember that these are the 8 and 12 mark questions worth 20%. These are your multiple choice and short response questions. When we're looking at how they actually mark the whole paper, this is the rubric for the entire paper. Okay, so objective response, so as we know, objective is you're either right or wrong. It's based on a measurement. Then you have short answers, and then of course we talked about before, we have those section 2, which is worth 40 marks, okay, giving you a total of 100. Clever little designs there. Okay, so some things about timing with your multiple choice. Look, most of them you will complete a multiple choice in under 1 minute. By the time you read the STEM and then the responses, so the STEM is the question, and then by the time you read the responses, you should be able to make that decision very fast. Okay, so my aim is 25 minutes. If you're spending less than 25 minutes, I think you're probably rushing through the questions, and you might be getting caught on a few of the little tricks that the markers put in. Okay, but if you're spending more than 40 minutes, that's way too long on multiple choice. Okay, majority of students do start with multiple choice, but as I said before, it is entirely up to you what you want to do. The short responses, so your 3 through to 8 mark questions, okay, as we said, there is a guide, all right, and you can write a band 6 response in that area. However, if you use another booklet, that's fine. Just make it very clear to the marker that you have in fact used another book. Your option sections, so your sports med and improving performance, will actually be written in provided books, okay, and we've talked about that, and I've shown you where you need to put the question number, and you can only answer A in that section, and then if you don't use all that paper, you just got to flick through, find B, and continue with B. And if you do use more than one book, you do need to indicate that at the back, okay. With the short responses, try and aim to fill the space required. Okay, so if you're not quite filling it, or you're only doing 4 out of the 10 lines, that means you haven't got the right information, or you haven't got enough information. Okay, so just extrapolate or expand on what you do have, in the hope that you're on the right track there. Okay, you can write the time frames at the top of the question, although that kind of tends to take too long. All right, if you just look at the clock as you're going. Make a mental note, okay, I have until 10 past, it's a 5-mark question, I have till 10 past to get that done, right? And then make that an effort to try and make that, keep that time schedule there. It's really important that you do some essays where you are doing that, okay, at home prior to the trial or the HSC. If you're sitting down with your watch or your phone, set a timer, okay, do a 3-mark question and give yourself 6 minutes to do it, okay, from scratch. So you start without having started a plan or anything, and then try and write to it. Mark it, put it against another question, and then see where you can improve. What is it that you need to speed up? Is it your thinking, your planning time? Do you need to increase your writing speed? All right, and also just do different papers is the big key. Paper after paper after paper. Okay. That's an example of the writing booklet that you will receive for your HSC, okay, and you'll be provided all that information from the marking supervisor once you're in there. Okay, so exam tips for multiple questions. Okay, so you need to read the question at least twice, right? Because what we're looking for is any grammatical clues, so most, qualification words, never, best, all those sorts of things. You want to read the question and be able to actually know what the answer is before you read the stem of the question. Okay, so highlight or underline the syllabus words, okay, to identify what is it they're actually looking for, because sometimes they might put a syllabus word from another area of the syllabus into the question just to kind of entice you to put that one. Any questions that are wrong, scribble them out, okay, because what happens is if you get a difficult question where you're reading it 3 to 4 times, you end up reading the wrong answer 3 to 4 times as well. So if you can eliminate that and cross them out straight away, it saves you a lot of time. Make a little note next to it, either put a tick or a cross or a little marker to say, I like the sound of that response, but I'm going to have a look at the other ones, okay? And anything without a syllabus term in it, okay, and then that's a big clue, especially when it comes to cancer and things like that. Anything we haven't studied, okay, is clearly the wrong answer. So here's an example. This is a question. You should be able to answer this question without even looking at what the responses are. So an athlete enters a sporting arena and gets nervous. So at the moment they go into that environment, they get nervous. What type of anxiety is this? Now we know there are 2 types of anxiety. We've got trait and we've got state. So straight away you're looking for either trait or state. And then because you know that an athlete enters a sporting arena and gets nervous, it's in that moment that they get nervous. Okay, we're talking about state anxiety, because it's only occurring when they enter that environment. So before you've even looked at the responses, you already know what it is that you're actually looking for. Okay, and we know that from the syllabus, Okay, so this is the part of the syllabus that we're looking for. Okay, so the answers were state, trait, natural, or arousal. So as you can see, they've thrown in arousal because it's part of that syllabus question. Natural we've never heard of, so we'd literally draw a line through that. Okay, arousal we know is for optimal performance, so we put a line through that. So even if you aren't 100% sure, you can eliminate 2 and make your best educated guess from both of these. Now don't forget that trait anxiety is a personality trait. They've got it for their lifetime. They're always anxious. All sorts of things make them anxious. A state anxiety happens only in that state or that moment. And in this instance, it's when they've actually gone in. Having a look at this question, which of the following is a government response to the issue of the ageing population? Now remember that the ageing population is lifelong protective behaviours and a government response to it. Okay, so which of the following is a government response to the issue of ageing population? So is it increasing funding for acute care hospitals? Okay, so what they're saying there is, do we increase the funding for emergency departments? Because remember, acute means short term, chronic means long term. Is that a response to the ageing population? Not really. Improved access to mental health in rural and remote areas. Well, yes, improved access to mental health, that sounds about right. But look at this, rural and remote communities. Up here it has nothing about rural and remote, so let's just put a little dash next to that one. Reduction in the numbers of trained doctors and nursing. So would the government actually reduce the number of doctors and nursing if we've got an ageing population? No, so we'd cross that out. Okay, and then promotion of good health through life and active aging. What is the definition of aging Australians? Is them making good decisions, good protective health decisions throughout life. So that's looking really, really good. Okay, so as I said before, we're going to get rid of that one automatically because that's not even on there. We're going to get rid of that one because it only says rural and remote communities, and the question has nothing to do with that. We're also going to get rid of increased funding in acute care hospitals because that's not going to help. Okay, it's a government response to the issue of ageing Australia's population. So obviously it is basically a definition. It is the promotion of good health through life and active aging. Here's another one. Which of the following descriptions is most appropriate for a player in the associative stage of skill acquisition? Okay, so the associative stage is that middle one. Okay, we have cognitive, associative, and autonomous. So if you think of cognitive as a beginner or a learner, right, an associative is a representative player, and then an autonomous is an elite player. So let's have a look at that. So which of the following descriptions is most appropriate? Okay, so when you see the word most, that means they're going to give you a few that are quite valid or valid for you to pick. So A is there's a high degree of temporal padding evident. Now temporal padding means they can do things without even thinking. Okay, now we know that's not true because that is one of the autonomous stages. The player has a clear picture of the task and practice is deemed easy. All right, now that's not quite right either because practice should never be deemed easy. If it's too easy, they're autonomous. Okay. C, practice results in observable improvement. So what they're saying here is that the mistakes are made, they're still evident, but there is much more improvement made. And that sounds much more like the associative stage. And D is whilst mistakes are made, the individual is able to complete most activities. So I like the sound of C and D there, but we need to look for the most appropriate. So we're going to get rid of A because high temporal padding is with autonomous. The player has a clear picture of the task. Again, that's more of an autonomous player. And whilst mistakes are made, the individual is able to complete most activities. I would assume that somebody in the associative stage could complete nearly all the activities. Okay, they just have a few mistakes. So it's between these two, and practice results in observable improvement is the one that I would go for. Okay, so here are some questions. How does Medicare reflect the principles of social justice? Okay. So two things here we need to know about Medicare and the principles of social justice. The principles of social justice are equity, diversity, and supportive environments. So if A, it provides resources only to those most in need of health services. Well, no, that's not it at all. Okay. B, it is funded by the Australian government. Yes, that is true. To supply equality in health services to all Australians. Well, that sounds very promising, so we'll put a little dash next to B. It allocates resources according to the needs of the population in order to improve equity of health outcomes. Well, that sounds quite good too. It empowers individuals and communities to be involved in planning. No, Medicare doesn't involve people being planning. So now I'm going between B and C. Okay, and I have to pick the one that is most appropriate, which I feel. Medicare doesn't necessarily allocate resources per se. That's the government's job. So Medicare is funded by the Australian government to supply equity. So at 14 would be B. Okay, read number 15 for me. After sustaining an injury, an athlete applies ice and a compression bandage. This is an example of which recovery strategy? Okay, so after an injury, an athlete applies ice. So ice is the strategy of cryotherapy, and compression bandages is a tissue damage, isn't it? Okay, because I've sprained or strained something of the tissue, so I wrap a compression bandage around it. So I would easily get rid of hydrotherapy. Okay, B, neural and hydrotherapy, and tissue damage and hydrotherapy. Okay, and now it's just up to me to know which one's which from the syllabus. And it is actually C. It's tissue damage and cryotherapy. Question 16. A health promotion initiative educates doctors to refer mental health patients to a social support group. Which area of the Ottawa Charter is this? Okay, a health promotion initiative educates doctors to refer mental health patients. So remember when we talked about the Ottawa Charter, when you think about reorientating health services, you think of a doctor, okay, doctor and reorientating health services, or nurses, or, oops, sorry, got to go back. They go together. Okay, so I'm looking for anything with reorientating health services. So which area of the Ottawa Charter should this be? As you can see, developing person skills? Nope. Well, they would eventually if they went to the support group, but that's not what the actual initiative is. Reorientating health services, strengthening community action, creating support environments. Said doctor, reorientating health services. So I'm going with B there. 17. Which group of skills is best learned using mass practice approach? Okay, so is it A, skills learned in an open environment? Remember that open means it's susceptible to other people, other players, spectators, all those sorts of things. Skills with a distinct beginning and end in the learning routine. Skills requiring extensive external feedback during the learning phase, or skills requiring a high degree of coordination. So again, which group of skills is best learnt using mass practice? So when you think about skills in an open environment, okay, they're obviously better done in part practice, okay, till you build up till you get to it. So I'd cross 17A out. Skills with a distinct beginning and end in the learning routine. So like kicking a soccer ball into a goal would be a good example of that. And that would probably be a good answer for mass practice, okay, because I can't really break that into parts other than the run in, stop, kick the ball, stop, which wouldn't be effective. So I'm liking B at the moment. Skills requiring extensive external feedback during each learning phase. That wouldn't be very helpful either, because with mass practice, the coach can't give you a lot of that feedback. And skills requiring a high degree of coordination. Well, they, in order to be learned effectively, they actually need to be done in part practice. So if you think about a very complex aerial ski jump or something like that, you can't do that all in once. You need to actually do the somersault first and the double twist, and then you start to put them together. So B here, 17B would be the answer. Okay, 18. Which row in the table shows the leading cause of mortality in Australia since 2013? Now this is a straight rote learning. Okay, so best way to answer these type of questions is you go down the columns, okay, rather than going across the rows, because then you have to read all four before you can eliminate. So the leading cause, is it all cancers? Yes, we know that it's all cancers combined. So B and D are automatically eliminated just by reading that first one there. So we're either A or C. Then it says the second highest cause is cardiovascular disease. Yes, both of them are cardiovascular disease. So it comes down to the third. Is it injury or dementia and Alzheimer's? And from our notes, we know that dementia and Alzheimer's, okay, is the third highest cause. So the answer here is C. 19. In which activity would creatine supplementation be most likely to enhance an athlete's performance? This had quite a lot of discussion amongst the PE teachers when this question came out. There are a few little hints as to when you read it several times, so that's why it's important to read a question more than once. In which activity would creatine supplementation? So supplementation means you're taking it for more than 5 days. Creatine is at 5 grams for 5 days straight. And it would need to enhance the longevity of creatine. So you'd need to be able to, you're needing to use creatine repeatedly, okay, and you don't have the time to stop and wait. So an ultramarathon, well, creatine isn't used in an ultramarathon, so we'll cross that one out, okay, because remember the ATP-PC system is where the creatine is predominantly used. A long jump event, that sounds feasible, so we'd put a tick next to B. 100-meter sprint final sounds feasible as well, and then a 2-kilometer ocean swim is not, because that's aerobic. So A and D are gone. We just need to decide between these two, okay? Now there is a word here that basically makes creatine supplementation more likely, okay? And the word here is an event, okay? A final is a one race, even though you would assume or infer that to get to a final you've probably done 1 or 2 things, but they're just talking about the final, okay? A final or an event. And an event infers that there is multiple times you have to compete. Okay, so knowing that there is multiple times that you have to compete, the answer here would be B. Okay, and the last one here is which group is most at risk of developing breast cancer? Is it a woman who takes a contraceptive pill and exercises regularly? We know that can't be it. Okay, contraceptive pill possibly. Exercises regularly. We know that obesity is a risk factor for breast cancer, so that one's gone just by having that N section there. B is women over the age of 50 and of high levels of circulating estrogen. Okay, we know that increased levels of estrogen does contribute to breast cancer, and we know that age also is a contributing factor. C, women who give birth to multiple children and breastfeed them. Well, it can't be that one because we know that breastfeeding and births are very, very good. Okay, and you'd assume that if they've given birth to multiple children, they've had their children before the age of 40. Okay, so we're going to cross out C. Women with early onset menopause is a possibility because we know that menopause can contribute to estrogen and using hormone replacement therapies. Okay, so go and look back there. Sorry, I said contribute to estrogen. It's actually a lack of estrogen. All right. So we know that early onset menopause part, okay, rules out D because hormone replacement therapies is correct, but the early onset menopause. If it was early onset puberty and using hormone replacement therapies, that would make that more viable. So the answer for 20 is B, women over the age of 50 with high levels of circulating estrogen. So this is probably the hardest question you're going to see. Don't forget, they're not going to make it easy of you, and this one is the most at risk of developing breast cancer. So as you see, there was 3 there that you'd have to talk yourself out of to get to the right answer. And there's the answers there. Don't worry about that one. Okay, with Core 1 and Core 2, you always have Core 1 questions come first, and then Core 2 questions will come after that. Okay, and again, it's up to you how you want to answer them, and they'll also go from low to high verb. So at the very top of the page on the paper, it actually says you will be assessed on how well you do what. Okay, and they are demonstrate knowledge and understanding. Okay, so how well do you actually show the knowledge, but also that you understand the concepts that you're actually talking about? Do you apply skills of critical thinking and analysis? And that's where those verbs come in. Can you show the relationship between something? Can you show how important something is over the other, or can you compare it one thing to the other? Which one is more advantageous than the other? The third one is communicate ideas and information using relevant examples. Remember the S there, please. You know, a minimum of 3 examples whenever you're writing about something, or if as you're going, you're writing an example for what you've just stated. So if you make a statement, in brackets, put an example. Okay, and obviously you need to present your ideas in a logical and cohesive way. So you can't do the snail trail and move all the way around. You need to make sure that you get to the point and it's very clear what you're talking about. So here's a sample question here. Argue the benefits of applying the Ottawa Charter to one health promotion initiative. So this is critical question 4 of core 1. Okay, it's worth 8 marks, so it is one of the biggest questions that you can get. All right, so it's actually got argue, and argue means to make a value judgment. Okay, and you can either support it, you can be against it, or you can be both. Okay, the other part is the Ottawa Charter. So you need to know your Ottawa Charter. In year 11, we studied the Ottawa Charter. So just repeating what developing personal skills are or reorientating health services is, defining it and giving an example isn't going to cut it in the HSC. You need to actually apply it. All right, and then you've got the benefits. So it's actually, so it wants the 4 part of this question. So what are the benefits? What are the positives of the Ottawa Charter being embedded into a health promotion initiative? Here's the criteria for it. So demonstrates clearly, up here, demonstrates clearly the benefits of applying the Ottawa Charter to one health promotion initiative. So if you are referencing multiple ones throughout, so if you jump health promotion initiatives, you're actually doing yourself a disservice, okay, because the markers want to know your understanding of one health promotion initiative. Now we studied road safety and close the gap. But if you wish to apply the tobacco is also another one that's really quite simple to apply. Provides clear links, so that's the relationship part between one health promotion initiative and the Ottawa Charter. So it wants to see how is the Ottawa Charter actually embedded in the health promotion initiative, and of course uses relevant examples. So you would need an example for every single Ottawa Charter section there. Okay, and if you just came in and wrote, that's Georgie going nuts. If you just come in and wrote outline the application of the Ottawa Charter, you'd actually only get half the marks for that. Okay, so it's really important that you're applying all parts of that question. Here's a sample script that put together with just to show you. So there's creating supportive environment, and then my ticks are going to be where we provide that information. So we've given you a quick definition. Ensures places people live, work and play are conducive to making good health decisions. Okay, this successfully is an argumentative verb there. Influences the National Tobacco Strategy, that's NTS, National Tobacco Strategy Initiative, which creates smoke-free environments for people in employment, education and recreation. Smoking is no longer, here's an example, smoking is no longer permitted near public and private eating areas and playgrounds. This ensures, as an argument, people are not exposed to excessive secondhand smoke and makes it difficult for addictive people to engage in the risky behaviour. This action area is also influences the HSC initiative, the entire notion of adopting a healthy canteen, so healthy school canteen initiative is the second one that they've used there. This makes school environment more supportive of strong overall health outcomes and reduces poor diets. Clear that creating supporting environments successfully influences health promotion in Australia. Okay, so planning is crucial, okay, when it comes to the extended response. This is the bit where you're going to, get lots of marks or lose lots of marks. So read the question twice, highlight the key words, identify at the top of it what you're actually going to write. Okay, even if it's like little dot points or mind maps, and tick them off as you go. Okay, make sure that you've got them in a logical order. So have each of your arguments in a paragraph each, leave a line, do the next paragraph in your extended response. This is the back part. And make sure you read the question to ensure your plan is correct. So after every paragraph, go back, reread the question quickly so that you're on the line. Make sure you underline your verb, please. Okay, that way it gives you a good identification if you are using your verbs. So anything between 3 to 6 marks is you're going to get identified, describe, define, outline, or an explain. Anything between 6 to 8, you'll get a demonstrate, explain, examine, investigate, distinguish, justify, or compare. And then in your option sections at the back, okay, is where the hard verbs come in. It's analyze, assess, evaluate, critically analyze, or critically evaluate. And remember the difference between critically and just the analyze. So analyze and critically analyze is that depth and sophistication in your writing. We've given you this 100 times, okay? It is in the Google Drive if you need to get it again, okay? But if you just remember these words down here, Okay, compare, some, like, however. These are not the only ones, okay, but if you can use those and then just throughout your response, okay, underline them to make sure you are using them. It's always easier to lead with a verb than it is to try and put it in between, except for these explains, because explains is a relationship type one. Okay. There has been a lot of moving away from the verbs, and they're just going to how, what, whys, to what extent. Okay, you just have to figure that out when you're in there. Have a look at the mark. What's the mark value? So go back to this one up here. What's the mark value? What do you think you need to put in? Significantly and important will always help out. Okay. Remember, you need to do that critical thinking. You need to show not only that you have the knowledge, but you understand it. Okay, and there will be look for opportunities to use the different meta languages between different syllabus areas. Okay, that shows you really know your stuff. Okay, so don't think because you're writing about maybe recovery strategies that you can't use some of those physiological effects terminology like blood pressure, hypertension, lactate inflection point, all those sorts of things. So that's one of the examples there. Okay, use the leading verb. Okay, don't rewrite the question. Never, especially in those short responses where you only get so many lines, please do not just get straight into it. Okay, a introduction is not required in the short responses. That's the 3, 5s, 8s, 4 mark questions. An introduction is required in the back section for sports medicine or improving performance, and all it is you are leading with a verb. Okay, maybe 2 if you can get in. If you can get more than 1 in there, that would be really good. And you are listing basically the syllabus terms that you are going to be talking about to show the marker what your next couple of paragraphs are going to be about. Okay, make it stand out. So if you want to underline it, if you want to dot point it, it's up to you. Okay, but you need to make sure the syllabus stuff stands out. Make sure you're underlining your verbs. Okay, you can use subheadings, things like that. It's entirely up to you. We've talked about that before. Just don't roll everything in together too close, especially in your extended responses, sports medicine, improving performance. Okay, make sure you leave that gap because they are long questions to try and read and answer and mark. So try and make it helpful for the marker. Make it logical. Okay, convince the marker. You aren't sort of being apprehensive and telling them what it all is. You are the authority on this information and you are telling it. And obviously, wherever there's an opportunity to use a syllabus terminology, you put it in there. Okay, everything on the paper is marked. You know that. Okay, so anything down the side, if you need to put something, write it up the alley, all those sorts of things. What happens if time runs out? It's an interesting thing. If you are up to the last question and your time runs out, I would highly suggest what you do is that is the only time I would suggest dot pointing. Okay, so if you're at the bottom and the exam supervisor says 2 minutes to go and you have maybe 2 sections of the Ottawa Charter to go, I would dot point. I would go creating supporting environments. What is the definition? Here's an example. Next one, strengthen community action. Here's the definition. Here's an example. It's the only time I would suggest dot pointing. Don't cross out things, okay? Make it legible. You can, if you've made a mistake, you just draw one single line through it, okay? Because it may be correct. We want to make sure that you can get in the information that you may have already put down and accidentally through, making an error in judgment, you panic and think it's wrong. Just put one simple line through it, okay? You need to demonstrate what you know, okay, and how much you know it. Look for the intent of the question. What is it that they're actually asking you to do? Even reword the question in your brain before you do it. And of course, we've always 100% talked about this. Examples with an S are critical. Okay. All right. So this, I'm just going to finish with this one. So this is explain how the priority issues for Australia Health are identified. So things we need to do is go for the explain. Okay, which is of course leads to results in effects. I would expect to see that written above your answer. How the priority issues is the 5 PCs. Okay, priority issues are the 5 PCs: prevalence, potential for change, priority population groups, cost, individual community, and social justice principle for Australia's health are identified. And then because you want to show that higher level knowledge, you need to put the national health priority areas, so cancer, CV, diabetes, right? You would explain, all right, why these 5 things are important based on cancer, CVD, and diabetes. So here's an example I'm going to leave for you to read through. So as you can see here, we've highlighted this little section here. I haven't actually put a definition in. All I've done is I've put the definition in bracket to show the marker that I've actually summarized it or given a synopsis of it. And of course, as usual, Mrs. Crow's answer is way too long, but this is just an example. Okay, we're going to stop there. I need a break. My throat is killing, and I'll come back and do call 1.